Thank you. And I will pass it on to Dr. Jane Morgan, who's the Clinical Director, COVID-19 Task Force Lead for Piedmont Healthcare in Atlanta.
Thank you, Dr. Valbuena. What a great webinar we're having today. You know, when we look at really the scope of where we are in this COVID pandemic, we have seen nothing like it before, certainly with regard to the entire scientific community galvanizing behind a singular entity and sharing information and freely sharing that information, including sharing patents. These are the types of things that we haven't seen before, as everybody leaned in really to preserve life and to save life, and we really, truly understood that. One of the things that I think has been very clear is in this pandemic, and there will be many lessons learned when we get to the other side of this, is that we really lacked a framework for how do we really care for our entire community? What is that framework? And oftentimes when therapies become available, not just in this pandemic, but in outside the pandemic, we see it in a centralized area, in areas of our large medical communities, our large medical facilities. And we need to begin to move towards what does that decentralization process look like? How do we begin to meet our community where they live, where they work, where they play, where they interact, as opposed to having people come to us? And what exactly does that look like in that model? And I think COVID pandemic is demonstrating that for us. Currently, we have about 482 counties in the United States that have a vaccination rate of less than 25%. As we see this Delta variant continuing to take hold, 10% of all COVID positive cases at the beginning of the month were responsible for this Delta mutation. As of today, 30% of those cases are now because of this Delta variant. We also have the Delta plus variant. We see now that this particular mutation is proving itself to be quite fit. And what is that going to mean? And what is this going to be in our next challenge? We've seen the cases of COVID dropping steadily over the last few weeks, and yet they have not returned to zero. In fact, they have plateaued and are quietly, ever so slowly climbing. And what that generally heralds is that we need to brace ourselves for this next surge that surely will come. And so these monoclonal antibodies are a clear therapy for how we can hopefully get to the other side of this. Certainly, we need to make certain that when we are providing education, we stress that monoclonal antibodies are not a choice instead of public health measures. So you do not have to follow public health measures because we have these life-saving therapies available to you. But we do need to make certain that that information is available. Black and brown communities, by and large, do not have warm relationships with our healthcare systems. Those relationships are somewhat tepid. And then when you bring in research as well, that relationship is almost non-existent. So this cultural concordance and cultural congruence of physicians and other providers who are speaking to all community and all potential patients is incredibly, incredibly important, because behind that is also the trust factor. The other thing that we need to think about as well are the regional differences. There are going to be not only racial differences, but regional differences. And certainly we've got Alabama, Mississippi, Louisiana, Tennessee, Arkansas, and Georgia. And Wyoming is also included in that, although not in the Southeast, really kind of rounding out the bottom 6 or 7 states as far as vaccination rates. Embarrassingly so, since the CDC is housed here in Georgia where I live, and our full immunization rate is 35%. So I think we can begin to predict where we will see these next pockets as we've been able to achieve community immunity, but not herd immunity. And then those pockets of relatively low vaccination will form the nidus of where we can begin to see these new mutations develop and perhaps begin to challenge the immunization status of the rest of us. So these monoclonal antibody therapies are going to be important as we go into this next surge, much more so than it has been previously. And we need to ensure that that information is available and that these therapies are available to everyone, including home health care. And that information, most people have not heard of monoclonal antibodies. It's sort of a complicated word if you're not in science. People don't really know what it is or what it means. And I think we need to begin to sort of demystify that when we have our conversations and move it forward. And so health literacy is going to be important, building these trusting relationships, mitigating the barriers, understanding what those barriers are with travel and cost, cultural concordance, and understanding as well that it's not a substitute when we're delivering this message for public health measures, for masking, for getting a vaccine. It is in the instance that you do become positive and develop some symptoms to keep you from becoming very ill. And so it's very important to make certain that we deliver that message in a very responsible way, such that people don't feel emboldened to eschew public health measures in lieu of life-saving therapy that's available.